Hello, NUR 100 students. Good to have you with me. So this week we are in Unit 8 and we're going to talk about professionalism. So I'm going to talk to you about what professionalism is through the eyes of a nurse and what some professional roles are as a nurse. So every day we're on stage. Your identity as a nurse goes with you wherever you go, whether you're aware of it or not. As a professional, we possess a body of knowledge and skill to go with it. This is expected by the public that we serve. The question becomes, how are we presenting ourselves to the public who is ever watchful? So professional demeanor, professional, conforms with the standards of skill, competence, and character normally expected of a properly qualified, educated, and experienced person in a specific work environment. Demeanor is the outward behavior, manner, appearance, presentation, especially as it reflects on character. So not ironically, both definitions are inclusive of the word character. So I don't know if you know anything about pilots, but they do a check ride every 6 months. So they take a check ride with a test pilot every 6 months, not to necessarily check their competence alone, but to put a mirror up. So to say, where have I gotten sloppy? What image am I projecting? So really, this is a great idea for all of us. This is a great lesson that we could learn in nursing to do the same exact thing on a daily basis. Image. What people know about you and what they can see is all they have to go on. They cannot see what you do not show them. And conversely, they may see many things that you do not realize that you are showing them. How others see you does matter. But this starts consciously or unconsciously with our beliefs about ourselves. Our beliefs about ourselves color all that we do and say. So how do you see yourself? When you present yourself, what's your appearance? How do you communicate with people? How do you behave? And what is your attitude? What attitude do you portray? So again, you see yourselves a totally different way than possibly others see you. So how do others see you as far as your appearance, or how you communicate, or how you behave, and what is your attitude? So fair or not, we are all judged every day by our cover. And we in turn judge others by their cover. So one thing that we need to be very conscious and aware of when we are caring for other people is, oh, excuse me, sorry, went ahead. Um, we have to make sure that we are clean. We use soap and water, shampoo, deodorant. That's really all it takes. When we're caring for people, however, we have to avoid heavy perfumes and the like, because somebody who is sick can become even sicker or maybe have allergies to the smell. So we have to be very cognizant of that as well. So you should also not smell of tobacco. Mints are usually acceptable. I don't really know any patients that have been allergic to mints in my career, but it's a possibility. But chewing gum is not really, it doesn't portray a good image, like if you're smacking your gum when you're in taking care of a patient. Shoes should be clean. Your nails should be short, natural, and if you wear nail polish, it should be of a neutral color. Now you will find nurses that wear nail polish that is not of a neutral color. And actually, there are quite a few nurses that I've worked with who are very flamboyant. But just try to recall that what kind of image you are trying to portray. Um, I just want to say something, kind of a side note about nails. A lot of women get their nails done and have artificial nails, but just so you know that there have been studies done and research done in neonatal intensive care units that have traced horrible infections that the neonates have gotten from nurses who have worn artificial fingernails. So just keep that in mind. They do carry germs, whether we like to think it does or not. Another along the line of cleanliness is your hair, which should be neat and tied back if necessary. You don't want it falling in a patient's wound, so keep it tied up or back in a bun or something. If men have facial hair, it should be trim and neat. And this is about safety, yours and the patient's. In the OR, where I used to work, we had actual special nets for beards and mustaches that the doctors and nurses had to wear if they had facial hair. If you wear makeup, you need to keep it simple and again, not flamboyant. If you wear accessories, necklaces, earrings, that type of thing, keep it simple and safe. No dangling earrings, no visible body piercings except for the ears. Be aware of visible tattoos. I know in programs that I have worked in before going to clinical, students had to make sure if they had a visible tattoo that it was covered up. So just remember that this is not about you. This is about the perception of the patient that you are caring for. You know, we care for a lot of elderly people who don't necessarily like a bunch of piercings and tattoos. So again, be aware of who you're taking care of. Clothing should be, again, clean and it should be not real wrinkly. You know, iron it if you have time, but at least take it right out of the dryer so it doesn't get all wrinkly. Should fit properly, shouldn't be too tight, too loose, and no matter what the situation you get yourself into during the course of the day, you shouldn't have to worry if there is skin showing that shouldn't be. Also be cognizant of when you are taking care of people, how does your patient know who the nurse is? Are you going to have a professional demeanor? How does your patient know who the nurse is? Of course, we should all wear name tags, and our name tags usually portray what our position is. You know, are we an RN? Is it a patient care technician? Are people from lab? That kind of thing. But still, your patient should know that you are a nurse because of the way you portray yourself, the way you carry yourself. Communication is defined as the sending and receiving of messages between two or more people. If it was only that easy, actually defining communication is easier than actually communicating. Technology has only complicated the matter. Even though we think that technology has made communication easier, it has complicated it. Ironically, face-to-face exchange continues to be the most effective form of communication. So now that we have all this technology, we have to interpret what people are saying. For instance, texting, there are a bunch of emojis, but do we really see that person's face? There's a lot of unspoken communication. Like sometimes when I get a text, I'll read it and perhaps I send one back, and who I don't know what they're saying on the other end or what they're thinking on the other end. Maybe they're rolling their eyes at me. I don't know. So there's a lot of things that we are missing in our technology as far as communicating. So again, just keep in mind we have verbal communication, we have nonverbal communication, and then there's the whole art of listening. Verbal communication is a two-way street. There should be a sender and there should be a receiver. The sender is the one who's responsible for clarity and should deliver their message in a simple, clear, and concise way. The sender has to be the one that ensures what is being said is what was heard by the receiver. The sender has to have credibility and speak with confidence. And remember that a message sent through a bunch of senders becomes distorted. So while we've been on this extended vacation, let me put it that way. I haven't been on vacation, but I think some people have during this crisis. But so the massive, massive amounts of emails that I have gotten have made it very difficult to like sift through them to see, okay, what are people really trying, like what's the bottom line message here? Can somebody just tell me 1, 2, 3? This is what is going on. 1, 2, 3. So messages tend to get distorted when there's a whole bunch of different senders. So when you're delivering a message, think about what you are going to say before you ever say it. There's I don't know if I mentioned this to you in this class before, but if you want to become a good communicator, like a really good communicator, work on your communication skills and your speech making skills. There is a organization that is actually a nationwide organization. It's called the Toastmasters, and they help people with vocabulary and delivery of speeches, listening, all of those types of things. So I just thought I'd throw that out there if you want to become a, really proficient at making speeches. So when you're communicating, you want to be assertive. We've already talked about assertive, passive, passive aggressive. You want to be assertive. Don't be wishy-washy. Stay away from terms like I think, it might be, it could be. You either know or you don't know. And if you know, be very forthcoming with patients, coworkers, physicians, your boss, etc. So the more you do that, it will just increase your credibility. So assertiveness encompasses a clear, honest, and appropriate statement of feelings, needs, and ideas. And it's non-threatening. Use eye contact and a warm smile when appropriate. Show empathy when appropriate. Passive aggressive has no place in effective communication. Have you ever heard, it's not what you said, it is how you said it? Use polite language. So everything I needed to know, I learned in kindergarten. Actually, I never went to kindergarten, but I think there's some kind of little book that says, that is titled that, Everything I Needed to Know, I Learned in Kindergarten. Actually, everything I needed to know, I learned from my mother. Sometimes we just seem to forget along the way how to say please, how to say thank you, you're welcome. I'm sorry if you've done something wrong. So all of those little words go a long way. Simple courtesy is not soon forgotten and is not overlooked. Grammar counts. Be aware of using slang expressions. And also be aware when you're taking care of patients, when you learn the medical jargon and the healthcare jargon, that is not effective communication if the person that's on the receiving end doesn't even understand what you're saying. So even worse, they're afraid, for whatever reason, to ask for clarification. So you need to use simple phrases, simple words when you're explaining something to a patient and talking to a patient. The last thing I want to mention is that as a professional, curse words or foul language should not exist. Nonverbal communication. We have to become readers of body language. Nonverbal communication is more powerful than spoken words. Frequently, it communicates a message behind the message that we're trying to give someone. It tells your audience more than the words that you're saying. So this is especially true, again, when you start next semester in clinical rotations and you're observing your patient and you observe nonverbal communication of your patients. It is so important as a nurse. Just like we are observing their verbal, we're listening to what they're telling us, we have to look at their nonverbals. And I might mention too that as we are listening to them and hearing what they're telling us verbally, looking at their nonverbal cues, they also are observing our nonverbals. So if we are standing there looking like we're listening to them, but we keep looking at our watch or we look at the clock or we look at the door, it says to them that we are really not interested in what they are saying. Or maybe we even roll our eyes. So again, be very aware of what your nonverbal cues are. Be aware of space and touch and other body language, like frowns, raised eyebrows, shrugging your shoulders, crossing your arms. Something culturally that you need to be aware of is eye contact. There are a lot of cultural differences. A lot of people do not like to be looked at like straight in the eye. Some people think that is very disrespectful, like certain cultures think that is disrespectful. Native Americans, this is just, kind of maybe off the point a bit, but Native Americans do not like for nurses or healthcare workers to come in with a clipboard and keep writing down what they say. They think it's very disrespectful. So you have to kind of memorize as you go with Native Americans, and just remember that you go in there, you don't take paper, you don't take notes, and you come out and you write down immediately what they said, or so that you don't forget. So, what's your posture like? Your shoulders back, your head up, eyes forward means I am confident. Your posture reflects your opinion of yourself, as does your walk or your stride. Are you hesitant and uncertain, or are you self-assured? Are your actions speaking so loud that others cannot hear what you have to say? Again, watch your body language and your nonverbal cues. Listening is an active process. We have two ears and one mouth. for a reason. And I've always said that it is no coincidence that the word listen and the word silent are spelled using the same letters. So when you're listening to a patient, or to anyone for that matter, be truly attentive. Listen to what is being said. Like, what are they really telling me? Acknowledge both verbal and nonverbal communication. Don't assume you know what is going to be said and fill in the blank, like constantly interrupting people or trying to finish people's sentences. Allow them to say what they want to say. With listening also comes the ability to empathize, to understand what others are feeling. So make sure that you are listening to your patients and to others. So barriers to listening. Be open to new ideas and ways of doing things. We all, or should be, continuing to learn every day. Put your preconceived notions aside and listen to others. Put your defensiveness away. It usually is a sign of low self-esteem. We should all take constructive criticism as a gift. It is through constructive criticism that we grow and improve. 95% of the time, if the person giving the constructive criticism did not care about you or the situation, they wouldn't bother giving the advice. Frequently, it's our own defensiveness that keeps us from hearing what is really being said. Lack of self-confidence, nervousness, and you're worried about what the other person is saying, thinking ahead to what you're going to do. You have too much on your plate. You have too much going on. So think about, or try not to think about any of those things, and actively listen. Don't interrupt people and don't finish their sentences for them. Some people just have a habit of trying to finish other people's sentences. So just if you are one of those people, be extra cautious about that. Again, electronic communication, the new technology. We lose the ability to see and hear with our eyes and ears. So we have to sometimes interpret what people are typing in these messages and saying on social media. We can't hear their tone of voice. We can't see their face. Abbreviations and acronyms may be misinterpreted. For the longest time, I did not know what LMAO stood for. And I was like, okay, what does that stand for? Or even LOL. It's like, what does that mean? So if people don't know what those things are, they're just going to get these preconceived notions about, okay, I'll look really stupid if I ask them what that means, that kind of thing. So try not to use abbreviations and acronyms because they can be misinterpreted. So again, with electronic communication, there's a lost element of the sender ensuring that the receiver understands the message. Like when I send a text, I don't follow up with saying on my text, do you understand what I'm saying? Yeah, that's not what I do. On the other hand, I do use talk to text a lot. And if I don't look and read my talk to text message before I send it, there are so many words that are wrong that I should have never sent that message. So talk to text is wonderful, but only if you're going to check it before you send it. So when possible, always choose face to face. You may not remember what someone says or does, but you'll never forget about how they made you feel. Communication that undermines your image. Whining, gossiping, making excuses, and having that victim mentality. Thinking of all of you, I can't even imagine any of you doing any of these things. So, your behavior portrays your integrity. It portrays if you are a lifelong learner, your etiquette, your care of yourself, whether you are a team player, and whether you like to mentor or not. So, how you behave. Integrity. Always choose the hard right versus the easy wrong. Mean what you say and say what you mean. Admit to your mistakes and own your practice. Like, I've got this and I know what I'm doing. One thing the profession of nursing has going for it is that nurses are considered one of the most trustworthy of professions, by the public that we serve. Yet, as with anything else, it only takes one indiscretion to muddy up the waters. Honesty and trustworthiness are values that run deep. They are expected, especially of us. If we cannot be trusted in little things, how can we be trusted in big things, such as saving lives? We see people at their most vulnerable moments. They put their lives in our hands. We are their advocate. They have already given us their trust. We must not let them down. It is about walking the talk. Say what you mean what you say. This holds true for your credibility in all situations, be it with the public you care for, physicians, co-workers, employers, family, and friends. It takes years to build a reputation of trust. It takes only minutes to destroy it. Timeliness reflects also on your integrity. It is about following through and doing what you say you will. When you say you will, it is about being reliable and dependable. So when you say you will, you need to do it. Choices. We always have choices to make, but deciding not to choose is making a choice. We have to hold ourselves accountable for our own thinking, our own behaviors, and the results that come about. Taking responsibility for choices is a big step toward making great things happen. A good name, like goodwill, is got by many actions and lost by one. Responsibility is about taking ownership of yourself and your work. It is taking credit for the good that you do. It is accepting compliments graciously with a thank you. It is also taking ownership when we have opportunities for improvement to say, what did I learn? How could I have done this differently? How do I now make it right? You're responsible for your professional growth. And if you are not continuously growing, you are getting stagnant. Subscribe to journals, take advantage of all educational opportunities, join professional organizations, go to conferences and network. It is your practice. How do you want it to be viewed? Always self-reflect. Again, what did I do? What was the outcome? Could I have done this differently? And if so, how can I make it right? Etiquette. Pure and simple, it's all about manners. It is about saying yes, sir, or yes, ma'am, no, sir, no, ma'am. It's about pronouncing a person's name correctly. It's about opening doors for other people. It's about acknowledging another's presence. It's about paying attention during a meeting or seminar, or at a minimum being quiet. It's about putting your cell phone down. It is about manners. These things speak volumes about who you are. Are you saying me and my needs are more important? Etiquette is not about me. It is about treating others the way in which you would like to be treated. Mentoring. A mentor is someone whose words, behaviors, and style you admire. Observe others. It will become evident whose practice you admire. Establish a relationship with that person. Model your practice after what is admired in others. All of us build our career on the shoulders of those who have gone before us. Thus, each of us is contributing our part to the profession. Preparing your successors gives you the opportunity to pay back to the profession for the benefits you received from others' support. The pay it forward phenomenon. No one among us has gotten where we are without being where you are. Both parties benefit. The profession benefits. So healthcare is not an individual sport. It must be a team sport if we are to survive. We must remember we are working on the same team. Teamwork began back in the days of the old bear hunt. No single bear hunter was successful alone. So it is with nursing. This is a lot on this slide. But teams help each other be right, not wrong. Teams look to make new ideas work, not make reasons why they won't. If in doubt, check it out. Don't make negative assumptions about each other. Speak positively about your team, your facility, your profession at every opportunity. Maintain a positive mental attitude. Act with initiative and courage. Do everything with enthusiasm. Whatever you want, give it away. Enjoy the adventure. You will only pass this way once. Choose to make a difference. In saying that, I also have to say that care for yourself is very important. If you don't take care of yourself, you can't take care of other people. Keep your life in balance. Things that matter most must never be at the mercy of things that matter the least. Live, laugh, and love. Life is short. Elements of self-care. This should go without saying, but you should get proper exercises, proper nutrition, recharge your batteries, work out your mind, refresh your spirit and soul in whatever way that is for you, and maintain a relationship with family, friends, and coworkers. Attitude is a little thing that makes a big difference. A positive attitude is one of the most valuable assets a person can have in life. Your attitude is totally in your control. No one else controls your attitude. Elements of attitude. Your thoughts. Choose your view. Check your focus. Control your input. Words. Talk yourself up. Speak with strength. Ask the right questions. Actions. Have a need? Help someone succeed. Move through adversity. Stay connected. Attitude is truly in your control. The worst thing we could develop is a victim mentality. There are no victims. We all have choices. If we do not like where we are in life, we have the ability to change it. Reality 101 about nursing. Nursing is 24/7, 365 days a year. You will rarely leave work on time. Many times you don't get lunch. Many times you don't even get to take a restroom break. The nurse-patient ratio that your facility tells you many times isn't going to be that when you actually get there. Just remember that once you start working clinically, you won't know everything, and that's okay. The main thing is that you can admit that, and if you don't know something, you go look it up. Everyone is not nice, and that even includes patients. And something about patients is just that they are our patients. They're ill, they don't feel well, so a lot of times they're not nice. Reality shock is experienced by everybody in some way, shape, or form. Emotional challenges will abound, but you will be changed. Things to help you along the way. Money isn't everything. Nursing has vast possibilities. There are so many things that you can do in nursing. If you get tired of doing one thing, there's something else that will surely spark your interest. Create a brain book, and that's kind of like journaling. Like what have you learned today? Self-care is a necessity. Buy high quality shoes and a high quality stethoscope. I still have my stethoscope from when I was in nursing school, and I still use it. Optimize body mechanics at every opportunity. Do not hurt your back. Do not hurt yourself. Find a trusted confidant, somebody that you can rely on telling things to every day. Utilize self-reflection every day. Again, what did I do today? What did I do well? What did I do wrong? How can I make it better the next time? Become resilient and persistent. Never forget why you became a nurse. Passion. The one thing you have that no one else has is you. Your voice, your mind, your story, your passion. Start every day your way. Live every day your way. You control your destiny. Everyone is watching. It is an onstage performance every day. How do you want people to see you? Do you want them to applaud your performance or boo your performance? Keep that in mind. I wish you an awesome journey in becoming a nurse.